Hi folks, I'm Chris Coraggio. Welcome back to the Health Connection. Joining us today is Dr. Paul Kelly, an oral maxillofacial surgeon. Doctor, thanks for being here.
Hey Chris, thanks for having me.
You got it. We're talking about dental implants today.
That's correct.
Who's an ideal candidate?
Well, if you're missing a single tooth to multiple teeth to all of your teeth, you can be a candidate for dental implants.
So across the board?
Absolutely.
Okay, and you have some models here to demonstrate a single tooth first.
Well, Chris, if you're missing a single tooth or you just recently fractured a single tooth, you can come into my office, be seen for a visit, and between myself and your general dentist, we can replace this missing tooth. The tooth is surgically removed, the implant's placed, the dentist then sees you back and places the cosmetic crown of that tooth after appropriate healing time has taken place with the implant.
Okay, so how long is your process?
So in my office, you're in my office for about an hour and 15 minutes on the day of the procedure.
Okay.
The implant's placed into the bone, and then the implant takes 3 months to heal, or what we call integrate. After the implant's integrated, you're then released to go back to your general dentist, your family dentist, your cosmetic dentist, to then have what we call the final restoration or crown of the tooth.
Okay, and this next model is for the entire mouth, the upper and lower?
That's correct. So a very common thing today we see, especially with smokers and other people that have had some health issues or perhaps just lived in areas of the country where there hasn't been a lot of fluoride and other good dental care, they'll have a lot of what we call dental caries or disease in addition to periodontal disease or gum loss or bone loss. They'll come in to see me for a no-charge visit in my office. Your general dentist will refer you over to be seen to find out if you're a candidate to have the teeth removed, implants placed, and then the fixed permanent restoration placed that day in my office.
So you could do that in one day?
That's correct.
Really? Wow.
So patient comes in, patient's often sedated, teeth are removed, implants are placed, the temporary restoration goes in that day at that appointment. The patient then goes home to heal. It's about a 3 to 4 month period of time, Chris, while these implants heal. Then they come back to see me in my office. What we'll do is test the implants out to make sure they've healed properly, and then we release you back to see your general dentist to have them make your final restoration.
Okay, so that's the role of the general dentist or the cosmetic dentist in all this, right?
That's right. So the general dentist is a key player from the get-go as we start the case, helping to treatment plan the teeth, the size, the location that they want the teeth to get the cosmetics of this case right. They'll involve the surgeon to make sure that the bone's handled properly, the gums are handled properly, and the implants are placed in the right position to allow them to have the best cosmetic and functional outcome.
So technology regarding this procedure has just grown leaps and bounds, I would imagine, right, in the last decade?
Absolutely. So, Chris, for example, you know, your grandparents and their grandparents, forever the standard of care in dentistry was just either a full denture, or if you had a couple teeth left, you'd have a partial denture. Nowadays, most dentists coming out of school that I know, they don't want to make a complete denture. They don't want to have their patients use creams or adhesives. The partial dentures have metal clasps that are unsightly that anchor around teeth. Over time, those other teeth that are acting as anchors become loose and problematic. So dental implants is the way of the future. It's current, it's the best, it's the latest in technology, and that's what most dentists would put in their mouth without any question.
Got it. Whether you're talking about 1, 2, 3 teeth or a full upper lower.
That's right. And what I love about it, each case is unique, just like you said, Chris. A single tooth on a professional that bit into something over the weekend that's missing a single tooth that needs it placed right on the spot, to 3 or 4 missing teeth that can be used by placing a couple implants and utilizing a bridge registration over the top of the implant, to full mouth upper and lower implants. It really changes lives. It gives back form, function, cosmetics, and it restores youth in a lot of cases to people that have been thinking that they have no other option other than look like they're 10 years older than they are.
Yeah, no, certainly smiles and a way of life comes back to folks. What's your guys' website at your practice?
PaulKellyMaxillofacial.com.
And a good phone number?
480-685-9696.
Dr. Kelly, I think you covered it all. Thank you so much.
Thank you
Great
for your time,
information. We appreciate it. Folks, we'll see you next time right here in the Health Connection.